Hi, good morning. Welcome once again to Moorgate Andrology. Now, today I want to talk about the side effects of penis enlargement injections. So these are injections of hyaluronic acid to increase your penis girth. They are an alternative to a fat transfer, which is still the most common way to increase penis girth, but certainly penis enlargement injections with hyaluronic acid are becoming very popular, mainly because they're a bit less hassle to have than a fat transfer, and you'll see why as we go through the side effects and recovery after having penis enlargement injections done. So let's begin at day one. You've had your penis enlargement injections done and you are on your way home, you're driving home. And that's the first thing we should mention. So because penis enlargement injections are performed under local anesthetic, just a local is all that's needed to numb the penis, then you can drive home after the treatment's done. With a fat transfer, you do need to be accompanied because that's done under general anesthetic. But with penis enlargement injections, very different thing. You can drive home, you can go home on public transport. There's no problem there. Now, when you get home, the urologist will probably have given you a prescription for a course of antibiotics. You should get these as soon as you can and start taking them, and make sure that you finish the course. That's really important. Don't stop them halfway through. Finish the course. It's just prophylactic. It's just for cover, but it's a good idea to take them. If you're feeling a little bit sore, then you could take paracetamol for pain relief, but most guys don't need it really. Again, if you need pain relief, then take your urologist's advice and take some paracetamol if you need to do. Now, depending on how the treatment was performed will depend somewhat on how much bruising and swelling you see on the following day. Now, at Moorgate Andrology, we were the first people to bring cannula treatments for penis enlargement injections to the UK. And I think it's fair to say that most providers of penis enlargement injection treatments also now will use cannulas. Cannulas have a blunt tip, not a sharp tip like a needle. And cannula treatments generally lead to far less bruising and swelling to the tissues of the penis. And the reason for that is that the cannula treatments ensure that there is less trauma to the tissues than needle treatments. It can be done perfectly successfully with a needle, but if you can get a cannula treatment, I suggest that might be better. But you may still notice a little bit of bruising at the entry point of the cannula. If you've had a needle treatment, then you probably had multiple stabs of the needle up and down the shaft, and you may potentially have more bruising and swelling. But all this anyway should settle down with time. Now, the key message here is that you should avoid sexual activity for at least 1 week after the treatment is done. The longer you can leave it, the more time that the treatment has to settle down. I know that in the UK there are various opinions about this. Some urologists, doctors will tell you can have sex after a matter of days. Others like you to wait for as long as 4 weeks. But I think the general advice is that you should wait at least a week before engaging in any sexual activity, masturbation, anything. Just leave the penis alone and let this treatment settle down. Now, as things begin to settle down, it's very important that you do some massage of the penis. When you've had penis enlargement injections done, you may see, or even if you don't see, you might feel the odd tiny lump or bump underneath the skin. And it's very important that you massage these to help excuse me, even distribution of the product along the shaft. Similarly, you might notice that your foreskin, if you're not circumcised, you might notice that the foreskin becomes a little bit tight in the first week or two after the treatment's done. If that's the case, then you massage away from the tip towards the base to help settle that problem down. And that might take a few weeks to completely settle. Now, in the first treatment, in terms of the volume, you may have had somewhere between 10 milliliters and 20 milliliters of treatment. There's no specific one size fits all in terms of the volume that is injected. Your urologist will have gone through this with you, of course, at the consultation. But remember that you don't have to go for a big number. You can always have more added. The beauty of hyaluronic acid treatments is that you can go back and have a little bit more added at any time if you want more girth. On the first treatment at Moorgate Andrology, we tend to suggest not much less than 10 milliliters because obviously you want to see a good result when you've had the injections done. Other things you might want to avoid: strenuous exercise for about 48 hours. Again, just giving things time to settle down. But you should find that things settle down very quickly after having these injections done. So that's all from me today. If you have any questions about the side effects of penis enlargement injections, or if you're considering having this treatment done, then please do get in touch with us here at Moorgate Andrology. We do actually offer a free WhatsApp video consultation with the urologist himself so that you can speak directly to the doctor and get all the information that you need. So that's all from me today. I look forward to seeing you back here at Moorgate very soon. But until then, bye for now.